Hello, everyone. My name is Bobby Redwood. I'm an emergency physician and a preventive medicine physician, and I have a particular passion for antibiotic stewardship. So, welcome to Redwood Studio. The kids are asleep, the hour is right, and it's time to talk improvement action networks. Thank you for coming today. A little background on myself. I originally trained in emergency medicine. I had an itch for public health and studied preventive medicine. And my research niche, well, in my second career, was antibiotic stewardship. So I started publishing on the topic. I got interested at my own hospital level and started the Antibiotic Stewardship Committee at Divine Savior Hospital in Portage, Wisconsin. And now I work with WHA to spread the word. So I feel very privileged to be with you virtually today. And hopefully I can teach you or share with you, I should say, a little bit of my experience on being a physician champion in antibiotic stewardship. And give you some tips, pointers, and pearls on how to find your own physician champion and how to retain them. Other things we'll talk about today: what to really expect from your physician champion, how to engage them, what are key times to use them, and really how to maximize their engagement in your antibiotic stewardship work. So my personal physician journey I sort of talked about already, but it really started because I was a nerd. Antibiotics is not the sexiest topic, and it takes a certain personality to find it. So I had that academic role. It merged into a hospital role, and then I really found enjoyment in networking with statewide organizations on antibiotic stewardship, and especially broadening the base with which we communicate and sharing the information from other regional hospitals, academic centers, so that we can all learn together and rise together in our journey. The physician champion should be a key component of your team. If you look at the CDC guidelines, having a physician on the team is really one of the essential starting steps. They lend professional expertise and credibility. A lot of antibiotic work has to do not just with bookworking, but personal clinical experience. And so you'll want to find physician staff who have experience with hospital-acquired infections, with multi-drug resistant organisms, and with prescribing antibiotics on a daily basis. When you form your protocols, if you want them to fly, you've really got to have that street cred behind them and people with on-the-ground experience to tell you if things are going to work or not. Your physician champion can liaison with medical staff and other physician-run committees. Unfortunately, there are cliques in the medical world, and sometimes to get into that committee or to have those candid conversations, you need a physician on your side. And then the physicians also have the advantage of just having those other physician networks, having access to academic departments in ways that other clinical staff might really not have. And so it's pretty easy for me as a physician who's networking with other colleagues to just drop an email to a chief of staff or the head of a department at an academic center, where it might be an awkward introduction, or your email may go unanswered if you don't have that background. And finally, we can influence our other physician colleagues. After all, if you want a clinical intervention to work, it's got to be disseminated through the ranks, and you've got to get all your docs on board. And so having a physician address the general physician workforce is a really key component. And then really, sometimes we're figureheads. You may have your pharmacy and quality staff doing most of the work here, and you need your physician to deliver it to patients, deliver it to news media, to deliver it to other physicians or hospital leadership. So sometimes even if your physician isn't working directly on a project, you may want to touch base with them at key times to basically spread the word. So where do you find your physician champion? Again, this is antibiotic stewardship, okay? It's not bone surgery. It's not sepsis care. It's not sexy. I think it is, but you see what I'm saying. So look to your nerds first. Look for people who are really book smart. Look for people who publish a lot and always have their heads in the literature. I actually got into antibiotics because I was terrible with antibiotics in med school. And for me personally, I always want to rise up. I always want to get better at things that I don't really do well at. And so it was kind of a personal challenge to me to really hit the books and learn about resistance patterns, learn about gram negatives, gram positives, how this all matches together. And so that's how I became a nerd, and that's how I got into antibiotics. People with high acuity experience or experience with chronically ill patients will also be key physician champions. If you think about it, if you're in the clinic prescribing, antibiotics to healthy young people all the time, you probably don't see as many antibiotic complications. Maybe a child rash here or two, maybe an allergic reaction. If you're working in the emergency department, in an infectious disease department, in a critical care unit, you're going to see the superbugs. You're going to see people die of multi-drug resistant organisms that you have no way of fighting. And basically, you're going to find physicians with a passion for antibiotic stewardship because they have that public health itch. They have seen individual patients die, and they want to better the community so they don't have to see that on a daily basis. And along that same vein, public health physicians from your health department or preventive medicine physicians, these are physicians who look at populations of people. And when you want to have a high impact on a population, look to the drugs, look to the multi-drug resistant organisms. This is a way that we can really affect change on a broad level. And after all, antibiotic stewardship addresses a public health emergency. So these people are going to be key allies when you're looking for a physician champion. And then you can look to physician quality leaders. So antibiotic stewardship has become part of the quality curriculum, along with DVT prophylaxis, along with surgical site infections, along with CLABSI and CAUTI. Antibiotic stewardship is right there. So if you find a quality leader who wants to engage with your project, there's a good chance that they already have a background on antibiotic stewardship or they're willing to learn. Now, let's say you've got your antibiotic stewardship physician champion. You know where they are, you've engaged them, they're ready to work. What is the right level of engagement? What should you ask of them? What should you expect of them? The real answer is the right amount. You don't want to overextend your physician champion. They're going to burn out. If you've got them going to every meeting, if you've got them looking at every little piece of data, if you've got them sending 10 emails a day, they're going to turn and run as soon as they see, because, this is, let's be real, very often a volunteer effort or a minimally paid effort. So a lot of us on our quality roles end up going above and beyond and spending extra time. You want to use that time wisely. At the same time, don't underutilize your emergency or your preventive or antibiotic stewardship physician. Example, if I'm on a project and I never hear from anyone, I send an email and it's unanswered, I just feel like the project's fizzling out, I'm going to find something else that's better worth my time. So you got to touch down at just the right time. Meetings, meetings, meetings. Use your meetings wisely, okay? If you have 4 meetings a month, choose the 1 meeting per month that your physician should be at. Maybe make the meeting shorter. Touch base at the bedside or when they're on clinical duties. See if they've got 5 minutes to lend your ears. As physicians, we have lots of meetings in our lives, and we didn't really go to school to train to be at meetings. And so we're a little out of our comfort zone in the office area. It's really nice to interact with colleagues from other departments, but not overkill. So when you have the meetings with a physician champion, use them sparingly, use their time wisely. Let them duck out of the meeting. If the first 15 minutes is about planning the project, but the last 45 is about the nitty-gritty data, maybe your physician champion doesn't need to be there for that. What you do want to do is use your physician's expertise for strategic planning and troubleshooting with clinical operations. So we know a lot about clinical operations. We know what kind of protocols are going to fly, what protocols are going to get stuck in the mud. We know that nurses and physicians are an absolute team and that we need to trust each other entirely. So we know if a project's going to work for physicians but not for nurses, if it's going to work for frontline staff but not for the support staff around them. And then finally, you can use physician champions as a way of getting buy-in from other medical staff. So we have a far reach in the hospital because we interact with so many different types of staff. And oftentimes, obviously healthcare is becoming a much more teamwork-based environment, but oftentimes the physician is the leader of that team, or at least the cohesive unit in that team. So if you want to have buy-in from everyone, it's good to have buy-in first from your physician champion. Now, how do you keep your physician champion? I think, they're probably equally hard questions. The first, easier said than done, if you can, pay them. Like I said, antibiotic stewardship is often underfunded. Quality work is often underfunded. But if you can help a physician buy down their clinical time or receive academic hours or administrative hours for their work, that's going to go a long way because we get asked to do a lot of volunteer projects. And so any sort of budgeting that you can find will be helpful. Make your physician colleague look good, right? If we can't have money, we want pride, or at least respect from our colleagues. And so if you have successful projects and you're able to showcase my role in those projects, you're able to let the rest of the med staff see that I'm engaged, that I'm working for patient care at different levels, that's really going to speak to me, and you're going to get me hooked. Include your physician champion on scholarly work projects. So that's another thing that we really enjoy is contributing to science as a whole, contributing to our specialty or contributing to public health in a way that others can see and use as an example. So if you're publishing or doing a research project, be sure to loop me in on that. Let me know how I can help. Don't just put my name on it, but really engage me. And that's going to be something that motivates your physician champion. And then finally, demonstrate the real lives that you're saving. You know, graphs are fine, but if you can show a physician that you've actually cut C. diff rates in your hospital by 20%, if you can actually show that your hospital-acquired infections are down for the year or your ciprofloxacin resistant rates are going down, you know, that's very meaningful for me. I have seen people with these multi-drug resistant organisms, and when you really present to me clinical, meaningful data, it's going to just speak volumes. And finally, if you're going to do thank yous, coordinate thank yous from not just a quality team, but from other teams that are meaningful for physicians. So other physician colleagues, have the hospital administration shoot me an email or give me a nod, have a patient come in and say thank you for my work. Those are the kind of thank yous that are really meaningful and that are lasting. So we've gone over a lot in just a few minutes, but I'm happy that you're here at the Improvement Action Network. I'm hopeful that you have a physician champion, and if you don't, please email me. Please let me know, and I can work with you to try to find one. And then finally, I hope that your antibiotic stewardship team is successful and able to use some of the advice that you get here today. It is a very interesting journey. It's an individual journey for every hospital, and it's one that's really fun to make. At my hospital, I'd say we're only a third of the way there so far. We're still working, we're still troubleshooting, we're still putting in protocols and trying to flex things up so they're hospital-wide. And so I'm sure we're all sharing a lot of the same issues as we muddle through this together. But this is a community, and that's what we're here for. So enjoy the day. Thank you for coming. What you do matters.